course overview of the class called CranioSacral Therapy, Working with Chronic Depletion. My name is Eric Moya. I'm the one who developed the course, and I've been an Upledger instructor for quite a while, actually, and teach a variety of the courses. And this is a course that really reflects a great passion of mine and an understanding of the work that's a passion of mine. And so I'm hoping to share it with you, and hopefully it intrigues you to come take the course either in person or online. Okay, so let's go ahead and get started. So just a couple of things about me in case you don't know who I am. So I have been in practice for about 24 years, which is hard for me to imagine that I've been doing it that long. And then I've actually been teaching craniosacral therapy for the Institute for 20 years. I've taught, I think, close to 230, 240 classes at this time. Okay. Hey, so I see we already have a hand raised. Elizabeth, I'm going to kind of hold the questions for now, but feel free to go ahead and type your question in the chat box, if you would. Okay, great. So the classes that I do teach for the Upledger Institute, I teach Craniosacral Therapy 1, Craniosacral Therapy 2. I teach the dissection class. Oh my goodness, that's another favorite class of mine. Sometimes I can probably get a little creepy talking about how much I enjoy the dissection class, but I do think it's an existentially powerful class and one that I recommend all practitioners to take. I teach all levels of the clinical apps, and then I also oversee the mentor program, and then this class, the chronic depletion class. And then there's a whole separate modality that is umbrellaed under the International Alliance of Healthcare Educators called Systems Informed Body-Mind Therapy, of which this class leads into that. And so I'm also the developer and teach that stuff. So anyway, as you can imagine, I keep pretty busy. In terms of my background, my first background is in massage therapy. My second background was in mental health counseling. So I really like the mind-body connection a lot. Now, I don't currently maintain licensure as a mental health counselor, but it's definitely a perspective that informs everything that I do. My current practices are in Carmel, California, and San Francisco. I'm sitting in Carmel, originally in New Mexico, and like a lot of us, I've been a seminar junkie for most of my life. So I've done a lot of deep study in contemporary and multidisciplinary approaches to trauma, studied osteopathy, studied positive psychology. I also am currently in the meditation teacher training program, the 2-year program, and have a deep practice on my own. And then I do love online education as well as in-person education. And then on my spare, I run a small online magazine called The Idea Crucible and moderate multiple groups, et cetera, et cetera. So I keep busy. I keep very busy. And then here you can screenshot this just so that way you have it if you'd like, in case anybody needs to contact me. This is my office here in Carmel. That's my phone number. I'm most active on social media. If anybody tries to message me, I am horrible at email. I don't recommend that you try emailing me if you want to hear back from me. And as far as Facebook groups, if you don't already know about them, the Upledger Alumni Group, I highly recommend. Good group. There's also the Body, Mind, Spirit group. And then for people who have been through the chronic depletion class, we have a separate group called the Epicenter as well. Okay. Great. So let's go ahead and get into it. Just want to do a little bit of a lecture first. And this is actually pretty much how I begin the class. So I kind of want to give you an idea, kind of the thesis of the class and what we're doing here. And I'm just actually going to read from the study guide here a little bit to begin with and kind of set the stage for what we're doing. And as you can see, the thesis overall is that stress, depletion, and resilience, that's what this class is about. And that we have, and my argument or the thesis of this course is that we have a growing problem happening as we've been watching, especially magnified by the pandemic now. I think this class is more relevant than ever. And so here's the overall idea behind the course. The world around us is becoming more complex. Previously, it wasn't. In the modern world, the amazing innovations of technology, communication, mobility, and information are exposing us to an increasingly complex landscape around us that is evolving and changing faster than we can easily adapt. In the recent past of even 100 years ago, people may not have traveled or been exposed to ideas, peoples, or connections outside of their immediate social community. Individuals, quite simply, were not exposed to the same level of diversity, interdependence, connection, or adaptation that we all currently are today. And so by any measure, the world is becoming more complex, socially, economically, politically, physically, ecologically, and biologically. And so what it means is as the world is becoming more complex, it means that it's also putting more stressors upon us. Now, the way an organism deals with stressors is to evolve. But as you know, evolution is a generational process. Evolution is amazing. Through mutations and trial and error, evolution is able to solve amazing problems of stressors placed upon a species. And it is a slow process of trial and error. And so one of the main ideas, and I think one of the unique situations we're finding ourselves in today's world, is that the world is actually increasing in complexity and placing stressors upon us quicker than the generational process of evolution would take. That's a really key part of why we're even having this conversation. And so continuing on here, in short, we have to evolve. Yet evolution is a slow process by which a system is put under stress and is either able to adapt to the stress or not. We're currently under that stress and needing to accommodate a world that is changing around us. So, okay, you already get the idea that I'm kind of painting the idea of this gap upon the human species, of the stressors placed upon us and our ability to compensate for those. All right, that's a cheerful way to start out a lecture, right? Cheerful way to, hey, good afternoon. We're all messed up, basically, is kind of the way that we're starting here. And here's the bit of hope. And my argument is that if there's any group of people that can help the species evolve and help the world evolve, it has to include the body, mind, spirit practitioners like you and like me. And the reason why I think the body, mind, spirit people are so important is because we basically live at the intersection of the individual and the world. So we're able to be activists in a sense of able to help the individual accommodate these increasing stressors, do that for ourselves, do that for our clients, and thereby kind of helping the world, helping the species kind of evolve a little bit here. And in terms of complexity, I believe that we're actually seeing this with our clients, that our clients are actually more complex now than they were 24 years ago when I got started. I remember for a while there, somebody would come in with a complaint, we would treat the complaint, they'd feel better, and that would more or less be the way it is. But increasingly these days, and I'm sure a lot of you can resonate with this, we have these clients coming in with their little wagons following behind them of all their Western medical diagnoses. They're showing up with TMJ problems and sleep disorders and environmental sensitivities and mood problems and physical pain and emotional pain and mental pain. And, the client may come in saying, hey, I want you to pay attention to my right shoulder, but they have all these other things going on behind them. I'm sure that doesn't resonate with any of you at all. And usually what it means too is that usually there's a Western medical system behind them that's busy trying to treat all the symptoms of all the individual little problems. And there doesn't really seem to be anybody that's really keeping their eye on the ball of a system underneath it that is just having a hard time regulating itself because of all the stressors. And that's where I think craniosacral therapists and body, mind, spirit practitioners can really shine. Because with our skill set that you've already been working to develop with some additional skills and some additional ideas, we're the ones that can kind of pay attention to that system underneath that can't properly regulate itself anymore. And so in many cases, clients are presenting with multiple problems, and the problems seem to have little logical connection, except for reflecting a system that can no longer regulate itself within healthy limits. The troubling thing for clinical practice as well is that most of these problems defy single session answers, and our clients are looking for help. Okay, let me catch up here. I have a couple of slides. I've just left that one up, but the slides that I have essentially say what we just talked about. So here's the core thesis of the course. The world is increasing in complexity rapidly, and particularly in terms of diversity, interdependence, connection, and adaptation. One of the unique things about the chronic depletion course is that I very much like to take a systems look at therapy, a systems approach to therapy, in particular, a complex adaptive systems approach to therapy. That may sound complicated, it's really not. Complex systems are wonderfully fascinating and endlessly intriguing. Anyway, so in the course, when we do start introducing basic systems theory and complexity science, those 4 words actually become really important, and we start defining them and talking about them individually. That any complex system is going to have appropriate amounts of diversity to it, appropriate amounts of interdependence, appropriate amounts of connection, and appropriate amounts of adaptation. And that when all those things are in place, we're looking at a complex system. The world around us is a complex system. The human being is a complex system. And again, evolution is a slow process, and we're under that stress and needing to accommodate a world that is changing very quickly around us. Then back to the idea of our clients getting more complicated. As a result, our clients are becoming more complex too. And again, I'm sure if you're working with people, you see all of these things. Again, somebody comes in with one problem asking you to treat it, but behind it, they're having sleep difficulties, TMJ problems, digestive problems, muscle tension, everything on that list there. And these are always problems that defy single session answers. And how many times have you had the client that say, okay, my neck hurts, how many sessions do I need? When you're aware that there is so much more going on than just their neck pain. There's postural factors and psychological factors and environmental factors and everything else. And so then for the solution, well, mind-body practitioners are at the intersection of the individual and the world. Therapists need to evolve their skills. And my hope is that this course is part of that dialogue. Okay, so let's just give a little data, give a little bit of hard facts around this. So I know that this is an international community, and it is very important to me in my value structure to honor that I am part of an international community and to think beyond the United States. That being said, the statistics and data I'm about to give you are all US related. So if you're not in the United States, apologies if this seems a little US centric, and I would invite you to, I would imagine most countries would have similar information. And it's not within my ability to go look for every country that I can find. What little bit of look and research I have looked at other countries, a lot of these statistics do tend to hold somewhat consistent. So I don't know that this is completely out of place. And I want to understand that we are in an international community here. Okay, so some stress-related statistics. Now, every year, the American Psychological Association publishes a report called Stress in America, where they're just doing research on, how people are faring in terms of stress. And so what I've done for our little chat today is I've actually looked at pre-pandemic data from within the pandemic, and then where we're at now as of 2021. And so just to paint a little picture of what's happening to us right now, stress-wise. So pre-pandemic, this is before 1999. 77% of people regularly experience physical symptoms caused by stress. 73% of people regularly experience psychological symptoms caused by stress. 54% has said that stress has caused them to fight with someone close to them. I laugh at that one because I really suspect that in reality that's much, much higher. I'm sure none of us have ever had the experience of a grumpy partner coming home and picking a fight with us, or vice versa in the process. And that 1 out of 3 people, 33%, feel that they are living with extreme stress. So this is before 2020. Now, during the pandemic, so this is a report that came out in October, November of 2020. And so this is all data that was measured very much in the middle of the pandemic. All that previous stuff that I was talking about was still in place, plus all this additional stuff kind of added on from the pandemic. And so 78% of people said that the pandemic is a significant source of stress. That's almost 8 out of 10 people. And that 6 out of those 10 people, or 60%, said that the stress was overwhelming and that they were almost at a breaking point. And then when identified what the sources of stress were, 77% of people feared the future of the country. And when they talked about which parts of that, Well, 66% identified healthcare, 71% identified mass shootings, 55% identified climate change, 51% identified the rising suicide rates, and 59% of people were concerned about police violence. And that was a number that is independent of race of the respondent. So that's just the vast majority of adults in the United States. And then here we are current for the most recent report released here in 2021. Psychologically, it is starting to refer to as we're in the beginning of a second pandemic, and that the second pandemic, it's one that is predicted to persist for years to come, even after the physical threat of the virus has been addressed, just due to the stress factors of what we've all been going through and the changes of the world at the present moment. So of those, what current data is showing is that 61% of people report undesirable weight changes that can either be increase or loss. 67% of people are reporting sleep changes and difficulties at the moment. 25% report drinking more alcohol. That's that's 1 out of 4 who report that. That might actually be a little higher. Here's a big one. 47% of people have postponed or canceled needed health care. 48% of people say that stress has increased since pre-pandemic, and 62% of parents report increased stress due to remote learning. Okay. Now, okay, so again, I know this is such a cheerful way to begin a topic, other than to just identify, hey, this is what we're working with right now. And here's the thing, though. It's like, okay, this is what we're currently going through as adults, but then we have the future generation too. You know, it's like, how is all this showing up with our kids? Because if things are negatively impacting our kids, then we're also looking at a generational problem, not just a several-year problem. Oh, and I forgot, there was one more bullet point on that one, and a very important one. Pandemic stress has also had a disproportionate impact upon communities of color. Latinx adults are more likely to report physical impacts of stress, and African American adults are more likely to report being concerned about life after the pandemic. Okay. So now let's take a look at the next generation. How is all this impacting our kiddos? All right, so pre-pandemic data. 69% of parents say that their stress only had a slight or no impact on their children. Again, any of us who have ever worked with families, we know that the minute a parent feels stressed, it immediately impacts the kids. But 69% of parents only believe that was the case. But yet 91% of children know that their parent is stressed because of the parents they observe. Yelling, and concrete observations, yelling, arguing, telling children about their problems, or being too busy to spend time with them. And then this is a little heartbreaking. 40% of kids say that they feel sad when their parent is stressed or worried. 40% say that they are worried when their parent is stressed. And then 1 out of 3 kids were already experiencing physical health symptoms often associated with stress. Okay, so now let's take a look at what are things looking at right now. Well, a lot of those are still holding true, but what's interesting, and I think this is extremely relevant for all of us listening to this right now, is the stress of the pandemic has been hard on all adults, but it's showing up as being particularly hard on Gen Z. So I have there are 2 age groups here. There are the Gen Z teens, which are age 13 to 17, and then the Gen Z adults, age 18 to 23. And that generation has suffered from the pandemic more than the millennials, the Gen Xers, or the boomers. And you might wonder why, because you think of them as the youngest and the healthiest. But the number-wise, Gen Z is showing unprecedented compared to previous generations at the same time. They're showing unprecedented levels of uncertainty, stress, and depression, and they do have rising suicide rates. And so when you ask Gen Z what their concerns are, 62%, or Gen Z adults, 62% cite rising suicide levels, 58% report being concerned about sexual harassment and assault that they see on the news. 79% report being concerned about the future of the nation that they're inheriting from the rest of us. 64% are concerned about the change in abortion laws. And then the current stress levels seem to be disproportionately affecting Gen Z women over Gen Z men. Okay, so cheerfulness, yay. So again, I want to illustrate once again before I show you this slide. Okay. Is it does that the overall point that I'm trying to communicate here is a world that's becoming complex quicker than we're capable of evolving. And so we're feeling this gap, our clients are feeling this gap. We need some solutions. I actually think the solutions are out there. And I think mind-body practitioners have a really important role in that. So my hope is that you believe that as well, and you're willing to kind of take up that charge. Okay, so now for this next slide, I actually would love to have you just type in the chat box here. Something got you out of your chair to sign up for this little 1-hour overview and to listen to this. And I'm curious, I would really like to hear and have you type it in. What was it about this topic that resonated for you or brought you into this meeting right here, right now? Let's take a couple of minutes. I'm actually just going to read them out loud because I don't imagine that the recording will have the chat box on it. Okay, so I'm not going to attach names to these for confidentiality purpose or privacy purposes, but I will read them. So one person mentions overwhelm, burnout at work, dealing with patients and their issues. Yeah, we hear the therapists are burning out as well as the clients. Okay, to help people out, one person writes in the question, what is chronic depletion? Somebody else writes in complexity of almost every client that comes in. Yeah, there's no such thing as a non-complex client. There's no such thing as a non-complex human. Somebody who's taken the class writes in, I want a refresher and to reconnect with the work. Somebody types in future of the nation. Yeah, we see that. Somebody else writes in exhaustion and fatigue. Routinely, when I hear this class, about halfway down, a lot of people write in that they're here for their clients, and a lot of people write in that they're, say that they're attending the class for themselves and that they're feeling depleted. Somebody else writes in chronic depletion is happening at all age groups, more so at the younger generation. Yeah, we're seeing that. Seems like most people have difficulty coping with really anything, not like the great generation, quote unquote. Another therapist writes in, I have many clients stressed to the max. I want to help them and have new skills. I am seeing more young people with anxiety. Who doesn't have mental health issues, right? Having experienced depletion and adrenal fatigue, I desire to prevent future fatigue. Somebody writes in, would love to have the information where your statistics originated. As I mentioned, every year, the American Psychological Association publishes a report called Stress in America. Easy to find. Just go type in APA Stress in America. You can find the previous 10 years easily of information. To help support us that are overwhelmed in general, and fresh opportunity for change. Okay. Thank you for typing those in. Yeah, again, like I mentioned, inevitably people sign up for the course in part because of, for their clients, and they want to enhance skills as therapists, but then a lot of us end up in the class for our own personal experiences too. All right, so let me do a little bit of an overview of the course so that way we want to make sure we get that in. Sometimes this class is actually a very big class. We cover a lot of material and cover a lot of ground. And for a lot of practitioners, it's a bit of a paradigm shift and a bit of a change in their thinking, much bigger than just what a term chronic depletion might be. And so let's talk high level for a moment. Yes, this course is about assessing resilience in our clients and depletion with our clients and supporting them. That is very much what the course is about. But it's also a much bigger course than that because the topics of resilience and depletion, it's a big bucket. It's a big bucket that can fit in a lot of really key ideas on how to work with an integrated person. And so and sometimes I'll get the feedback, well, I don't really have a whole lot of depleted clients. I'm like, yes, but I'm sure you have complex clients. And so the information in this course isn't only about depletion and resilience, it's extremely useful information for any complex client presentation. So if you have clients that are coming in with whole hosts of problems, this is a course that will have a set of skills that will be immediately useful to you. As I mentioned, it is a little bit of a paradigm shift for a lot of people. And so I do think that everything in this course is about looking at the integrated body, mind, spirit and working with it in a slightly new way, a way that's based on an understanding of complex systems. And then also I've been very careful in this course that everything in this course is in deep alignment with contemporary thinking on trauma-informed study, contemporary neurobiology, complex systems understanding. It's in alignment with contemporary mindfulness research and practice. And it's in alignment with the core CST principles as well. Okay, so like I said, that's a lot that we're trying to do. So what does the actual outline of the course look like? All right, here's essentially what we're doing. It's a 3-day course rather than a 4-day course. Gotten a lot of feedback that people really like the 3-day course format, in part because it would be kind of funny to have a course called Chronic Depletion and then deplete people. And being someone who's taught a lot of 4-day courses, people often get a little tired on the 4th. And so 3 days seems to be nice. We get together, we learn a bunch of stuff, and then we go home. And people generally feel pretty good at the end of it. Okay, in a lot of my teaching, I like to organize things around themes. And so the first day, to me, the theme of the first day is all about the depletion and all about resilience. So we show up and we do introductions and welcomes, similar to what we did just now. And then right away, we talk about, well, what is resilience? What is depletion? What is chronic depletion? And we end up defining those. And then once we've defined those, then we give you some new evaluation skills on how to evaluate your clients, to figure out their level of their systems resilience and the level of their systems depletion. Then scattered throughout the course, there are a couple of what I call slight paradigm shifting lectures. They're just lectures that kind of are taking a look at body, mind, spirit work from a systems point of view and kind of helping teach us and move us in that direction. So after we learn how to evaluate for resilience and depletion, we have the first of our little paradigm shifting lectures, and I call that whole person functioning. And in that one, we talk about models of health and disease, and we talk about the history of models of health and disease throughout human history. And then we talk about the rise of the biomedical model, which would be the prevailing model in the Western world, certainly to this day. And then we also talk about the biopsychosocial model, and then end up making the argument that in our type of work, we do really good to operate from something that I like to call an expanded biopsychosocial model of health and disease, where we're really taking into account the contributing factors of about 6 different multiple parts of the person. Okay. Then once we do that, then we spend the rest of the first day talking about, okay, since we're all body workers and we're touching people, well, what are common tissue factors that contribute to a state of depletion? What are things that you can do with your hands to help prevent depletion and reverse depletion with our clients? And one of the things we do is we talk about core restrictions which are in the core of the body versus peripheral restrictions. And we're very careful to say that, any restriction is important to treat, of course, but when the more core a restriction is, the more it tends to diminish the vitality of our craniosacral system or our core system. And so from a resilience depletion standpoint, we'd like to pay attention to core restrictions first, sometimes. And craniosacral therapy is actually extremely good with core restrictions. I mean, we treat the sacrum, we treat the vertebral column, we treat the dural tube, we treat the cranium, we treat the brain. The one part that we don't have in our curriculum are the rib articulations. And rib articulations very much count as core restrictions. And so we put it in here and we teach you. We teach you how to assess the rib cage, and we teach you how to treat the rib cage. And we teach you how to treat vertebrocostal articulations. We teach you how to treat sternocostal articulations, and then also the costochondral articulations. I love the rib work, and I consistently get feedback from people that the rib work is a really important part of the class. And rib work is valuable not only to help with human mobility and motion in terms of the thoracic spine, it's good to help with vitality because rib restrictions are core restrictions. And also on top of that, once you realize that we breathe on the average of about 30,000 times a day, even the smallest rib articulation problem turns into a bunch of wasted energy that can be much better spent on other stuff. And so hindering breathing is another way that rib articulations can, or rib articulation restrictions can diminish a person's resilience. Okay, so we do that, that's fun. And then we have a chance for the rest of the day to do a little bit of a review of some other skills you know from craniosacral that are significant core restrictions. So we remind you about the triad of compression depression that we talk about in Cranial 1, and then we give you some new assessment skills on how to evaluate that triad quickly if you suspect that you have a client that might be depleted. We remind you about the mouth work because the mouth work are very profound core restrictions if they're in place. So we remind you on those, and then we also give you some additional quick assessment skills to determine whether or not a system needs that mouth work. And then we end that first day where you just get to do a very nice trade with each other, specifically with the goal of treating core restrictions. So like a lot of upper level craniosacral classes, we're not only teaching you stuff, but we're giving you opportunities to get on the table and really get some nice work done for yourself as well. So that's the first day. Then when we come along to the second day, if the theme of the first day was resilience and depletion, the theme of the second day is systems and complexity. Stuff I love. Oh my. So we show up on that first day, we do a question and answer, then get started, get to do a basic introduction to systems theory and complexity science. It's a really fun way of looking at the world. And then that's a little bit of a theoretical lecture that people tend to find really interesting. But then we spend the rest of the day, okay, that's all nice that we've talked about systems theory and complexity, but what does that mean for practice? What does it mean for our hands? And so we spend the rest of the day talking about, well, what are some lessons that we can learn from complex systems to help us in how we treat people? And there are lots of things that we could do. We focus on just a few on this day. We talk about window of tolerance. And for any of you who are trauma informed and trauma skilled, you're probably very familiar with the idea of window of tolerance already. Super important. Basically, we never want to push a system faster than it's capable of integrating the change. And so we always want to be careful to work within the system's window of tolerance. Another skill that we learn is we learn how to work a complex pattern, or we learn how to work a system iteratively. And an iterative style of working is a way of working, of influencing small changes and allowing the system to integrate the small change before trying to change again. So it's a way to kind of keep both the big picture of a system and get really detailed at the same time without overwhelming the system and yet having significant pattern change. Part of that process is also developing roughly equal amounts of influence states and witness states where we're trying to influence the system, but then also allowing the system to integrate it fully. One of the ways that we challenge people on that one is to realize that healing doesn't happen because of the healing doesn't happen when you're doing a technique. Healing happens in the integration. Healing is what happens between the techniques, not while you're doing the technique. And so that's where that equal balance of influence and witness becomes so critical for long-term and effective pattern change. We also learn how to palpate something called REV. REV is a level of agitation that a system feels in response to its environment. REV is something that we can palpate 100% of the time when we're in contact with the system closely. And REV becomes one of the most important things to pay attention to make sure that we're treating the system within its window of tolerance and that we're not pushing the system faster than it's capable of integrating change. That's something that's important for everybody, but it becomes especially important with trauma work, especially important with sensitive systems work, and especially important with depleted systems work, because depleted systems become hypersensitive and unpredictable. And then the big stuff that I get really excited about, we close day 2 is we introduce the idea of not working restrictions, but working a whole pattern at once. And so we go through this process of kind of mapping all the restrictions in the body and finding the balance point that engages the entire pattern created by those restrictions at once. And so it means that we have to start learning how to look at not just things, but look at the relationships between things. And so the skill that we teach that really is very new is the skill of engaging and treating a relationship rather than engaging and treating a restriction. And that skill we call epicenter. And so the epicenter to treat the global pattern of restrictions we call a global epicenter, which you have right there on the GEPC. And we always tend to begin a session from global epicenter. And then we also bring up the idea that there's a global pattern, but there are always lots of sub-patterns. And so we learn how to treat them using a regional epicenter. And so we're beginning the conversation of global pattern and sub-patterns. So that's day 2. Then day 3, the theme of day 3 is, all right, sustaining change, sustaining pattern change. And this is the day where we most directly get to start bringing in counseling skills into looking across multiple treatments and really working with our clients a bit more. So we're talking about sustaining new learning. We are learning from, from psychology and from osteopathy and other places on how people change successfully and how people don't successfully change. How do people change habits and patterns? There's some really great research and knowledge out there on that. And then, what can a complex systems understanding teach us about effective pattern change and about effective therapy? And then what are appropriate coaching and counseling skills to help us within that? Then we're going to wrap up with an overview of ongoing educational supports for you, an overview of the curriculum that jumps off of this. And then, we have the course conclusion. And if it's in person, that's usually where we do a closing circle and everybody's is slightly emotional, and then people like to hug each other and then leave. So you know how an awful lot of classes end, basically. Okay, so let's just take a little bit of a break for a moment. I do want to just, before we go, wow, I just talked for 45 minutes. Before we go, I would like to give at least a little bit of a definition of what depletion and resilience is. But I want to take just an opportunity. I've covered a bunch of stuff. Do you have any questions so far? And you can raise your yellow hand or your physical hand if you have your camera turned on, or you can type it into the chat box. All right, I see you, Miss Karen. Could you please unmute yourself and let's hear what you have? Oh, and if you could turn your camera on too, please, so that way I can see you talk. I'd appreciate it.
Hi, Eric. Thank you. So my question is, when you're working with someone with ribs that are broken, can you still, how do you work with someone like that if you're trying to do, or would you not do rib articulation?
Oh, okay. Well, I mean, if someone has broken ribs and it's an urgent situation, I would definitely want them to get beyond the urgent situation before I put hands on. And I think that would be the case with pretty much any condition. But that being said, I've worked with an awful lot of people with ribs that are in the healing process. And even when the ribs are very tender, we're doing it with a cranial touch. And so I found the work really effective. Just within the past couple of weeks, actually, have a client who had a major fall during a hike. Significant. She thought she might have broken her ribs. The doctors just evaluated them as significantly bruised. So they weren't broken, but she was in a lot of pain, difficulty breathing, difficulty lifting heavy objects, difficulty moving. And we're able to do the rib articulation work, and it was very, very beneficial, almost right away in her case.
But this is not taught in any of the other CST courses, only in this. Is that what you were saying?
Yeah, I think they're, if I remember correctly, I believe that in immune classes, they're in the thoracic version of the immune class. I think Tim introduces some rib work that does look that looks different than what we're doing here. where we're specifically evaluating for individual articulations and working them individually.
Okay, very good. Thank you.
You bet. I see a question here that got written into me direct message. How do you handle the hands-on part when on Zoom? So that's a question for not the in-person version of this class, but the online version. On the online version, what I'll be doing is we're actually breaking it up over 4 weeks on Saturdays. And so all I'm going to do with Zoom is give the lecture and the information and then show you the demo videos. And I'm not actually going to oversee the hands-on part, but everybody's going to have assignments to go practice. So I'll be like, here's, for this part, go practice this 3 times. And so everybody will be obligated to go practice on their own during the week. And then what I'll be doing on the week in the middle is I'll have online mentorship calls where I'm just here to answer questions. And so what I will expect people to do is to go practice the assignments and then show up to one. The Zoom calls, the mentorship calls are optional, but it would be really helpful for people who want to get the feedback to having tried it a few times to show up to a Zoom call. And that's a chance to ask questions and get feedback and replay the videos and stuff like that. Yeah, I'm actually really looking forward to it. I think that will be I think it will be a really nice way to leverage the strengths of online education in a way that works for deeper learning than just plopping it all in 3 days in a row on Zoom. Okay. All right, so I don't want to keep us inordinately long. Feel free to raise your hands if you have other comments, but let's go ahead and keep on going. And let's just do a little bit of a definition of depletion and resilience, at least how we do it in the class. And I'm actually going to begin with a little bit of a journaling prompt. I actually want you to get a piece of paper out and jot a few notes down for yourself first. And here's your prompt. You can tell I was building this for the online course. You don't have to pause the recording. But here's what I'd like you all to do right now. I would like you to think back to a time when you were completely stressed out and overwhelmed. I'm sure we all have that situation. You were already past your breaking point and you had that feeling that if any other little thing came along, that the whole house of cards is just going to crumble and everything would be lost. If you can remember that time in your life, what I'd like you to do is to now just in your journal or on your piece of paper, write down what that experience was like for you. And in particular, I want to hear what it was like physically, emotionally, mentally, and spiritually. And if you would create those little categories, create the little physical category, create the little emotional category, the little mental, the little spiritual, and try to get something under each of those. And we'll give you a few minutes. Okay, so you can keep journaling if you want to, but let's start typing some of these in. And what I would like you all to do is to only type in whatever you put under the physical category. So just type that in and I'll read those out loud. We have exhausted and unstable, distressed, exhausted but wired. The feeling of toughen up, like throwing up. Heavy heart, tired but wired. Exhausted and unable to sleep or eat. Yeah, know that one. Exhausted. Not liking myself at all. Fat. Yeah. And 20 pounds of weight loss. A feeling like I would break. Okay. So that was all under the physical category. Here, this, not sleeping, not eating. Yeah, absolutely. Keep typing in them, and only on physical though for right now. And then what you have on the screen in front of you, and this is from the last time I taught this class, I do the similar exercise because absolutely I can give you a definition of depletion and I can give you a definition of resilience, but sometimes it's really helpful to just crowdsource it. Oh, we just got tight muscle, shallow breath, high blood pressure, short and fast breathing, hands and feet are cold, pain, tired but wired, heaviness. Yeah. And take a look at, again, what you're looking on your screen in front of you. These are respondents from an actual class, from actual people. This is not me making them up. So no time, decreased exercise, muscle tension, pain, decreased sleep, headaches, increased sleep, decreased eating, poor digestion, crying, increased eating, weight loss, weight gain, decreased energy, disconnected, numb, fidgety, throat or stomach tightness, restless, shallow breathing, holding breath. So you can see how your experiences really matched a lot of those just now. Now let's do the same thing. Now let's shift over to the next category, which would be the emotional category. If you would type in what your experience was like emotionally compared to physically. Sad, overwhelmed, angry, sad. Numb, yeah. Ready to cry, angry, and defeated all at once. Fragile, raw, vulnerable, crying all the time. Intentionally focused to not lose it, yeah. Sad and numb. Stuck but could not get out of the negative cycle. Hyper alert, for sure, and fearful. Sad and cry. Okay, let's take a look at what came up in the last time I taught this class. Similar: anger, reactive, sadness, frustration, numb, helpless, loneliness, fear, resentment, hysteria, overstimulated, drained, fearful, tearful, depressed, anxious, confused, hopeless, absurdly funny, hilarity, and mania. Okay, so I want to highlight something. This happens every single time I've taught this class, and it's something that I've seen clinically working with people over the years. As I really, and it's come up in your responses and it's come up on the ones that you see in front of you, is that we have opposite reactions. And one of the things you'll notice is that when the system gets really stressed out or gets really taxed out, it starts operating at the extremes. It's like it loses the ability to operate in the middle ranges. And instead, somebody will become like hyper emotional, like overly emotional, and then all of a sudden become numb. And instead of responding to the world with an appropriate amount of emotion, it's like all or nothing. Similar thing on the physical category, where somebody can be overly sensitive and have a lot of pain, and then all of a sudden they can't feel anything at all. This feature of flip-flopping between extremes is so predictable that I actually think it should be considered a diagnostic criteria all by itself. So that way, if you have a client or you yourself find that you're kind of vacillating between extremes, that by itself might be a sign of severe depletion or a sign of significant stress upon your system. And when you look at it that way, it's actually really quite nice, because you start to realize that, oh, well, one of the goals of therapy is to help us recover the nuance to our life. And one of the goals of therapy is to help us meet the world appropriately. That instead of that, if a situation, you can have a situation where the the response that's warranted is a small amount of anger, not like rage or not like numbness. And so we want to be able to meet the world fluidly, flexibly, and appropriately. And so I like the idea of therapy helping us recover that ability to meet the world rather than be reactive to it. Okay, so let's do the same thing. Now type in mentally, please, whatever you put in for your mental category. And while we do this, start looking and noticing for those flip-flops between extremes. So under mentally, we have distress, can't see forward, can't think or function, everything is harder to do. Yeah, avoiding, totally, tired, confused and indecisive, hard to concentrate, couldn't take on one more thing, not thinking clearly, shock. Yeah. Okay, so let's take a look at what we have here. Oh, freeze, tired, definitely. Difficulty concentrating, poor communication. And so with this other class, we have self-doubt, incompetence, poor memory, decreased concentration, brain fog, hyperfocus. So you're starting to see some of the extremes, everything from hyperfocus to an inability to focus, disconnected to overly focused, autopilot, decreased self-esteem, negative thoughts and beliefs, mental compensations, overly analytical or underly analytical, numb, we heard that. Yeah, decreased organization, worry, perseveration. Perseveration, that's like the rat wheel, constantly going. Poor judgment, volatile, and hypervigilant. Okay, and let's do one more. My favorite category, perhaps, is the spiritual one. So type in now, what was it like for you spiritually? Direct difficulty finding my connection to self and all beauty of life. Definitely. Wanting. Oh, good word. And notice how wanting, when under this category takes a particular meaning to it. Finding peace. So there we get the flip-flopping that sometimes in severe insignificant stress, people can actually find peace. Solid. And then we have disconnected, lack of faith and trust. We really see that flip-flopping here. Questioning the why. Oh, and then another one, questioning the why. Keep questioning myself. Disconnected, totally. What is going on? Why? Trying to focus on being thankful. Wanting peace. More praying. There we go. We have disconnected, and then we can have sometimes really diving into prayer and religion. And then we also have easier to be quiet and inner draw. So under the, total surrender to my God or totally left out. Yeah, that one all by itself has both flip-flops there. So with the last class, we have ungrounded, loss of faith, loss of energy, purposelessness, disconnected, forsaken. Oh, that's a word with a good spiritual connotation. Abandoned, meaninglessness, hyper-spiritual, desperation, urgency, savior search, like an inappropriate savior search, blaming God, loss of hope, and then spiritual isolation. Okay. So here's some takeaways I want you to take away from this little exercise. And even as you start thinking about your own clients on this one. First off, of the previous responses, I'd like you to notice which responses made sense to you. We're like, oh yeah, that's what I experienced. But I also want you to pay attention to which responses did not make sense to you, because these are all responses from real people. And so there's no way you could have had all those experiences. And knowing ones that you don't have might be helpful in spotting them with other people. And then also, as I have been stressing, notice how in a state of depletion that a system begins operating from the extremes. It becomes reactive. It can't meet the world fluidly anymore. And so the more stressed and less resilient the system, the more reactive it becomes and the less able it is to respond subtly. Okay, so, I really want to keep going because we're really about to get into something good. Let's see. Okay, I think we can keep going for maybe another 15 minutes or so. You're all cool with that? I mean, I guess people can drop off whenever they want to, right? We got 31 people in here. All right. So anyway, I did plop. This is one place where I gave myself a little exit ramp to just stop because I thought we might be at about an hour at this point. I am happy to take a couple of, so we're going to go over just a little bit longer, maybe another 15, 20 minutes. But let me take a couple of questions just from what I've given you so far. Any big questions that you all have, feel free to raise your physical hand, your yellow hand, or type it in the chat box. And then you have a couple of dates in front of you right there. One question, okay. Which Portland, Oregon, or no, yeah, be Portland, Oregon is the Portland one. Oh, and then continue. Okay, great. Oh, and there was a question that came up earlier. Let me see if I can go find it again. A question that came in a little bit ago was, how do practitioners without counseling backgrounds manage with the counseling skills aspect, staying within available skill set and scope of practice? Does that make sense? Yeah, it makes total sense. So I actually think that everything about this course very much enables you to stay within your scope of practice. It is well within all your scopes of practice to talk to people and to sort of track people and to offer gentle suggestions. Like you can offer stretches and you can offer basically helpful suggestions. I'm not inviting people to go into deep process. More what we do in this class is more like being a really warm, supportive coach or a really warm, supportive, caring individual. Like it is well within all of our scopes of practice to say, hey, what's important to you? And somebody says, you know, I really wish I could exercise more. And you're like, well, how much would you like to exercise? I'm like, well, I'd like to exercise. I'd like to go for 3 walks a week. It is perfectly okay within your scope of practice to say, man, that sounds really wonderful. Is it okay with you if I track that with you? And they're like, yeah, sure. And then the next time they come in, you're like, hey, I know you wanted to walk a little bit more. How'd that go? And so those are ways that we can really kind of support people in pattern change and in achieving their goals without stepping out of our scope of practice. And so that's how in this course we manage to work with lifestyle patterns and still remain within our scope of practice. And then here's a question that just came in. You address extremes in the course. What about lean thresholds? And could you unmute yourself and ask that question and put your video on and ask that question in person, please? I don't know that I fully understand what you mean on that.
Hi, Eric. Can you hear me?
Hi. Yeah, sure can. Thank you.
It's Lalita. So where stress is concerned, when you don't have far to operate outside the threshold, like you just have this narrow window of where you can function, but anything that takes you out of it ends up in these great highs or super lows. Do you address that at all in the course?
You bet. And it kind of sounds like you might have something in mind. What are you thinking of currently?
So especially like women moving through menopause and just the stresses of life and trying to continue maintaining, but I just see that literally physically, and now that I'm entering into it myself, I'm experiencing it on top of it. But how that affects, like, it just seems like we end up having a lot less to work with before we're reeled outside of the capacity to actually function well.
Yeah, okay, thank you for that question. I think I understand what you're getting at more. Yeah, and we really started addressing that in the whole idea of window of tolerance. And that what you're describing, that in some circumstances, our window of tolerance can shrink. You know, the trauma can shrink our window of tolerance, or our hormonal cycles can shrink our window of tolerance, stress. And we can actually have different windows of tolerance for different circumstances. Like somebody could have a very small window of tolerance when anger is involved, but a very large window of tolerance when sadness is involved. And that same idea of window of tolerance applies to the body and applies to tissues and applies to body systems. And so we really start working with that on day 2 when we start talking about window of tolerance. We start talking about palpating rev. you know, the level of agitation the system is feeling in response to the influence we're providing. And so if we're palpating rev, then we can be sure not to push the system faster than it's capable of integrating the change. And then for our long-term pattern change, if somebody's really doing their work and we're really facilitating well, that window of tolerance is going to expand. And there are lots of ways that we can identify the expansion of a window of tolerance. It's hard to get into in this little short thing, but yeah, other than to say we do talk about that. Does that give you a little, how does that land with you so far, Lolita?
Yes, that's wonderful. Thank you.
Okay, you bet. Okay, so I want to go just a little bit farther to, well, I want to go a lot further. I just, let's do the whole course right now, shall we? No. All right. So let me give you a definition of resilience. I feel like it would be good to at least do this for taking your time to be on the call. So this is a modification of a definition of resilience that's common in the psychology field. Now, I did modify it a little bit to be more general because the psychology definition is going to focus on psychological resilience. And I find that that definition is a very good one that can also be fully applied to the body and to the spirit as well. So here's a slightly modified definition. Resilience is the capacity of a system to cope with stressors and navigate its way to resources to sustain well-being. And then I'll add in the body, and that we can think about that on the body, on the mind, and on the spiritual level as well. And then I want to highlight that there are two parts to that definition that I want you to notice. The first part of the definition is that it's the capacity of a system to cope with stressors. I would imagine most of us, if we were asked to define resilience, we'd probably put that one in there. I'm glad that the definition doesn't stop with only that, though, because if the definition stopped with only that, we would be inclined to think of resilience as something that was innate, something that we're born with. And indeed, some people are just naturally born with more resilience than others. Some people are just naturally born with more sensitive systems than others. But experience in the clinical setting and research shows that it's not only innate. We can learn resilience, we can build resilience, we can build and enhance our window of tolerance. And so that's why I love the second part of this definition, is that it's also a system's ability to navigate its way to resources to sustain well-being. And so, yeah, I think we can engage that. And well, that's the crux of therapy right there, is what we're doing with our clients. And you can look at it this way. If a person or a system's capacity to compensate is greater than their stressors, so their capacity to compensate is higher than whatever stressors they have, then we can say that their system is resilient and building resilience. And so you're starting to get the idea that I really think of resilience and depletion as flip sides of the same coin. And so depletion would be the opposite of resilience. It's when the stressors are greater than the body's capacity to compensate. And from our point of view, we're looking at that body, mind, and spirit. So then people ask, all right, so what's chronic depletion? Well, chronic depletion is what happens when the system burns out and starts losing the capacity to rebuild. Basically, when a system is, like, it's normal for a system to gently cycle back and forth between depletion and resilience. But if for some reason a system spends too much time in depletion, what ends up happening is that gap between the stressors and their capacity to compensate for them, they become so far apart that it's almost unrecoverable. And that's the point where I would say that someone is chronically depleted. And when the system becomes chronically depleted, they become unpredictable. They become hypersensitive, they become labile, meaning they flip-flop back and forth between extremes. Okay, so chronic depletion. This is not this is not a scientific diagram. This is just something I drew to try to illustrate it. And let me get my little pen here. So let's imagine that this dotted line up here is basically a person's capacity to compensate. And let's pretend that this dot, that this straight line down here is somebody's stressors. If we could somehow quantify all the stressors in a person's life, psychologically, environmentally, everything else, if we could somehow give that a number, that would be this bottom line. And so what I'm trying to show you is that if a person's capacity to compensate is greater than their stressors, well, then they're going to be resilient. Here, I didn't like that. Let me delete that. There we go. Now, by contrast, at the minute that somebody's stressors overtake their capacity to compensate, then they're depleting themselves. All right, that's pretty straightforward. And that's what I mean by you can think of resilience and depletion as flip sides of the same coin. Now, I won't go into this too much right now, but something we go into more in the course is that a healthy lifespan and a healthy individual, that we naturally cycle between depletion states and resilient states. You know, that it's very normal for when a person becomes depleted, it's normal for them to start examining their life and start thinking, okay, what can I take off my plate? And as they take things off their plate, they gradually move into resilience. And it's normal for when somebody is resilient to then start thinking, okay, what's my next challenge in life? And then they put more stuff on their plate, which gradually moves them into depletion. And so one of the things we talk about in the class is how this kind of biorhythm between resilience and depletion states actually helps us evolve. It helps us actualize. It helps move us through our life stage and our life stages in development. And one of the really good things that we can do as therapists is to understand this and to work within this biorhythm ourselves, mindfully, that when we move into depletion, to take things off our plate to recover our resilience. And as we build resilience, to mindfully figure out what our next challenge is going to be. And if we're taking care of ourselves in that way, then we're also able to really take care of our clients too. And that it's very within our scope of practice and wonderful when our clients get depleted to help them take things off their plate. And when somebody is flush with resilience, to engage with them in that conversation of, okay, what's next for you? And to kind of honor that. So that's a healthy life. Chronic depletion is when somebody spends too much time in depletion without ever moving back into resilience. That gap between the stressors placed upon them and their capacity to compensate for them, it's like it accelerates and they become so far apart that it's almost impossible to come back from. If you truly have a chronically depleted system, you both have your work cut out for you. That's going to be a long-term process. It's not a one session kind of a thing. I remember there was one woman a number of years ago that I worked with. Her diagnosis at the time was something called general adaptation syndrome, which isn't really a diagnosis that's used very much anymore. What was general adaptation syndrome at that time, we would now think of as extreme adrenal burnout. Anyway, I remember asking her what her experience of her life was like. And she painted a picture that she would basically sit at home on the couch all day, unable to move and unable to take care of herself. And that the phone would ring and she would just burst into tears. So think about that for a moment. This thing ringing, you know, a phone ringing, it's a stressor. It's a mild stressor. It's a mild stressor that makes us take a look at it and be like, yeah, I don't want to answer it right now. And we just put it back down. Imagine having a system that's so sensitive that that ringing results in immediate and rapid overwhelm. That's what we're talking about by chronic depletion. And so by that definition, you may not actually have a lot of clients that are really, really in that level of depletion, but you probably have a lot of clients that are depleted. And I think the vast majority of our work with every last one of our clients is if we're just helping them be in healthy relationship with that biorhythm, that's a really amazing amount of work that we can do right there. So chronic depletion. When someone spends a prolonged time in a depleted state, the gap between stressors and compensation capacity seems to widen exponentially. Once this happens, it can become very difficult to overcome. Both you and your client have work ahead, and awareness of the resilience depletion biorhythm helps you as a practitioner be better prepared to support your clients. And then a couple of notes on that resilience depletion biorhythm. It might be tempting to think that being in resilience all the time is the goal. But if we were in resilience all the time, we wouldn't evolve, we wouldn't change, we wouldn't actualize. So without acceptable stressors, the body, mind, spirit system doesn't evolve. Think instead of a healthy lifespan involving a gentle movement back and forth between depletion and resilient states. Part of our work as therapists is to help support our clients and ourselves in being within this movement mindfully and to work within this movement. And this is one of the places where we need to really cultivate an awareness much larger than one session at a time. Okay, I'm going to go ahead and stop there because that's actually starting to enter into a whole different thing. Like I said, I showed up with more prepared than I knew we could possibly get through. All right, let me take a look at some of the chats and answer any questions. And where are we at? Okay, so here's a direct message to me. Not sure whether to ask you here or email you later. Is this approach to craniosacral therapy and chronic depletion similar to a biodynamic or somatic experiencing approach? I think there are some overlaps. Let me say somatic experiencing. I would say everything in this course is very up to speed with contemporary trauma-informed practice, and that can involve window of tolerance, co-regulation, overwhelm, stuff like that. So to me, resilience and depletion is a much bigger bucket than trauma. It's a bucket that can fit all of trauma. And so it would share some similarities to any trauma-informed approach that would also be talking in terms of window of tolerance. And so I guess what I'm saying is any trauma-informed approach is going to be talking about that stuff, of which this is part of it, not just somatic experiencing. And then biodynamic CST. Well, we do learn how to palpate something called the underquality. I think that has some similarities to what the biodynamic folk would call the long tide. Other than that, we also tend to take a bit of a witness approach. I think that might have some similarities to biodynamic as well. Okay, any other questions? Well, I really hope we get to see some of you at the class coming up. That would be a real treat.